hope you all are doing great. So today we'll be studying about the tetracycline, which is nothing but the class of antibiotics that are chemical substances produced by microorganisms that usually have the ability to kill other microorganisms without causing any harm to person, animal or plant. These are derived from the bacterium Streptomyces colica. This tetracycline was discovered by 1940. Okay, we have next the classification of tetracyclines. So these, according to the duration of actions, are classified as short acting, intermediate acting and long acting. Short acting, usually we have the half-life of 6 to 8 hours, and intermediate we have for 12 hours, and long acting 16 hours. So the short-acting drugs are tetracycline and oxytetracycline, also chlortetracycline. Intermediate we have democyclocycline and methacycline. And for long-acting we have the very well-known drugs doxycycline and minocycline, also marketed as drug Mino. Alright, and in the syllabus we have the short acting and long acting drugs, and we do not have the drugs belonging to the intermediate acting class. So generally this is the structure of tetracycline, which has a naphthacene pharmacophore, that is 4 fused ring system. Okay, here we have dimethylamine, and you can see the ketone as well as alcohol functional groups are present. Okay, and there is also acetamide present over here at the fourth or the A ring of the part. So generally this is how it is segregated, and this is a chart which I have made easy for you all to remember all the structure. So usually the numbering starts from year. Alright, 1 2 like this. So for R1, and we have 4 substitutions: R1, R2, R3 and R4. So based on this substitutions the drugs are derived. So in tetracycline you will have your H, R2 pe you will have CH3, R3 pe you will have OH, and R4 pe you have again H. So H, CH3, OH. This will give you the structure of tetracycline. Okay, and it is same for the chlortetracycline. The second, third and fourth positions are similar if you all compare, and just add the R1 substitution. Instead of H we have chlorine group. All right, and then again for the oxytetracycline the R1 is substituted with H position, and now here the R4 hydrogen is substituted with the OH group. And in doxycycline you have R1 R2 hydrogen bond, hydrogen attached, and R3 you have CH3, R4 you have COH. Okay, and the structure of minocycline is totally different. This moiety is repeated again at R1 position, that is N and dimethyl. Okay, and then everything other are HHH. Now we move towards the mechanism of action. So these are specific inhibitors. Okay, these are generally known as protein synthesis inhibitors of bacteria. Okay, they bind to the 30S ribosome subunit and thereby prevent the binding of amino acyl tRNA to the mRNA complex. Okay, to the mRNA ribosome complex, and thereby inhibiting the protein synthesis, bacterial protein synthesis. All right, so how does it takes place? We have the structure over here. So here we have other antibiotics also, but the tetracycline over here binds to the 30S ribosome, which interferes with the tRNA anticodon, which reads the mRNA codon, and thereby the amino acyl moiety is not attached to the mRNA, and hence there is no protein synthesis. Okay, and you can see for other protein synthesis inhibitors, chloramphenicol and erythromycin, which is a macrolide that are binding to the 50S ribosomes, whereas the streptomycin and tetracycline bind to the 30S ribosome. And they simply, just avoid, or just avoid the binding. Okay, and as there is no binding of tRNA, there is no further protein synthesis. And only in the case of your aminoglycosides, in aminoglycosides there is a production of faulty protein, so that mechanism is of action is different. And for tetracyclines and macrolide, and usually the chloramphenicol and this chloramphenicol और tetracycline का सेम होता है, मैक्रोलाइड का, सॉरी, मैक्रोलाइड और chloramphenicol का. So yes, we move ahead with the structural activity relationship. So if you all see the structural activity relationship, the fourth ring which you will say is, that is, the numbering is starting, as I said, from this position. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The last fused ring or the fourth fused ring is your A. Ring A, ring B, ring C, ring D. Now we'll study about the structural activity relationship. So generally the substitution, okay, will go from the second position. So this acetamide convergence to nitriles causes 20 folds an increase in the activity. This ketoenol tautomerism between C2 and C3 is very important for the biological activity. Modification of OH at third position leads to loss of activity. Epimerization at C4 and dehydration at 5A results in the loss of activity. Substitution with OH produce water-soluble derivatives which can be administered orally. C2 increases the antibacterial activity. Double bond C2. Okay, elimination of 6OH group increases lipophilicity and produces the more stable and is more stable to acid, that is doxycycline. Then we have the dimethyl moiety and dimethyl moiety at 7th position, that increases the activity. Electron donating and or electron withdrawing groups attached at C4, C7 increase the antibacterial activity, that is R1 position. The D ring should always be aromatic. Changes in the ring leads to the biological inactivation of the molecule. Additional acyl amino substitution at the 9th position leads to the new class of antibiotics, that is glycycycline, that is tigacycline, that is also called as tigacycline. Now the linearly fused tetracyclic nucleus, this entire nucleus is very important for the antibiotic activity. If this naphthazine pharmacophore is absent, obviously there will be no antibiotic activity. Okay, then we have the stereochemistry here. Stereochemistry में generally the 4A, okay, 4, 4A, 5, 5A, 6 and this 12. Okay, this 12 are potentially chiral, that is depending on the substitution. मेथासाइक्लिन है, ऑक्सीटेट्रासाइक्लिन है, मैक्लोसाइक्लिन है, डॉक्सिसिलिन है, okay, that possesses 5 hydroxy substituent that have 6 chiral carbon and others have only 5 chiral carbons. Okay, note that the carbons that join the rings are numbered as referred to XA, where X is the carbon in the front of carbon joining. There is no 6A at all. Okay, so it is just telling about this कि ये जो X है वहाँ पर 6A नहीं होता है. Amphoteric nature of tetracyclines. Amphoteric nature is nothing but to form the salts neutral, that is with both strong acids and bases. Okay, It generally have the structural units representing 3 pKa values. Alright, and this information is not required. And you should also remember that this tetracycline, this is the stereochemistry points, and this exist mainly as zwitterions and they are yellow in color. And the HCl salts are used for oral administration and usually given in the form of capsule to mark the bitter taste. Okay. So you'll also see here that the removal of dimethylamine reduces the activity. Addition of higher alkyl amines reduces the activity. Substitution of amides by aldehyde or nitrite reduces the activity, and the coordination of the metal platinum and palladium ring A on tetracycline and doxycycline increases the activity. I'm sorry. The system ketoethanol ring D is important for the activity. Alright, then we have the spectrum of activity. As we know, it is a broad spectrum antibiotics against gram positive and gram negative bacteria such as spirochetes, mycoplasma, plasma, rickettsia, and chlamydia. Then we have administration. Oral capsule in the dosage form, which are tetracyclines, are most commonly administered. The capsule should be taken at least half hour before or 2 hours after food. Intramuscular route is not recommended for the tetracyclines. Okay. Pharmacokinetics. Chlorotetracycline is orally absorbed 30%, and other categories, that is tetracycline, oxytetracycline, are 60 to 70%. Doxycycline and minocycline are fully absorbed 95 to 100%. So usually the doctor prescribes doxycycline or minocycline. Okay, that is marketed names are Mino and Doxy. Dairy products and antacids produce divalent cations. Buffered tetracycline solutions are formulated by intravenous administration, and 40 to 80% are bounded with the serum proteins. Then we have adverse drug reactions. There is a huge, there are huge side effects for using tetracycline antibiotics on a long-term maintenance. That is that decoloration of teeth, yellowing of teeth, stomatitis, nausea, erythematous rashes, that is red rashes, redness, sore throat, headache, photosensitivity, nail discoloration, exfoliative dermatitis, that is a skin disease, fungal like infection. Uses it is used widely to treat variety of infections including acne. Okay, it's an antibiotic that works by stopping the growth of bacteria. It is also used in the venereal disease, atypical pneumonia, cholera, relapsing fever, and rickettsial infections and plague. The drug interaction, obviously the tetracycline antibiotic should not be taken with the calcium supplements as it produces the kidney stones, okay, kidney sand in fact. Mineral supplements, multivitamins, cholesterol lowering drugs, that are statins, and penicillin compounds. Penicillin compounds are usually itself antibiotics, but they have a large drug interaction with that of the penicillin compounds and may cause severe side effects. So, thank you everyone.